Hey, what's going on, everyone? Welcome to today's episode. We're going to be talking all about pain and pain science. This is something that there's kind of a lot of controversy around. There's a lot of misunderstanding around this. And so I actually invited Dr. Raymond San Agustin back on the show. Previously, we talked about getting lifters out of pain, but then thought it would be pertinent to actually record a follow-up episode just discussing pain in a little bit more depth. And so first off, thanks for coming back on the show. It's good to have you here, man.
Thank you for having me. It's always fun.
So why don't we, I guess, just couch the discussion in kind of classifying what pain is, and then we can kind of go into like previously held beliefs around pain and then how that's transitioned and sort of evolved over time into the current BPS model and what direction you think that's going in as well.
Okay, cool. I think we talked about this last time too, and the definition of pain is the uncomfortable experience from potential or actual tissue damage. And then we kind of like diverted and discussed whether or not what's the difference between pain and injury, and is there an overlap or is there not? And it had me thinking, I was like, I wonder if there's like an actual definition for injury. And it was just like, yeah, that there's some sort of loss. And that was kind of what I was going about last time, is there's a loss of function, or there's a loss of something that is otherwise meaningful for someone. And I think that's like still my best foot forward in terms of what injury is. So pain, and by no means am I an expert on this, but I find being equipped with something to explain to patients on a day-to-day basis is important, especially whether it's chronic pain or like they're athletes and just trying to figure out or navigating why something's a little more sore than others, or why they can't quite get into their regular training habits. And just telling them it's about sensitivity. It's just whether or not that part of the body is telling you to chill out, either because your capacity is lower than usual, because you're sleeping like shit, eating like shit, or you're stressed out. And like, there's a lot of factors that are coming into place. Sometimes it's just your volume capacity isn't quite there yet, and you're just going over that threshold. Or sometimes your intensity capacity isn't quite there yet, and you're going over that because your mean intensity over your training block is a little bit higher. There's so many factors, and kind of like asking the right questions for your patient, or your client rather, is going to be the most important thing. Like, really, because you got to figure out why that's happening.
Yeah. And so I guess previously, and this is still, I think, fairly deeply couched, sort of idea of this mechanistic, biophysical type of pain and sensory input. And so a great example of this would be like a disc herniation. So I wrote an article on this a while back. And I remember when I was looking at a lot of the research on back injuries, I was actually really surprised at what I found. So, just looking at the kind of mechanisms for injury, but then looking at how many people have, or like, I guess, present with those mechanisms, but then have no experience of pain whatsoever. Like, I can't remember the exact figures off the top of my head, but something like 19 to 23% of all people with posterior disc herniations present with no symptoms, or something to that effect. So don't necessarily put on that, but like it's a pretty significant figure, and then like 66.66% of all herniations have spontaneous reabsorption. And you're like, wait, what? And then like people with MRI imaging, like some people present with significant pain and they get imaging and there's no tissue damage. At least that's detectable anyways, I'll say. Which is, again, really interesting. And so that kind of, I don't exactly know when the BPS model really was introduced initially. I know that I'd say probably within the last 10 years, at least as far as I'm aware, that's kind of when it started to gain a whole lot more traction. Yeah, so typically that was kind of like the older model, the biophysical or biomedical model, I believe is
Yeah.
maybe how some people call it.
Yeah.
Where it's like, you hurt your leg because there's a cut. You tore a tissue and now you're experiencing pain. Whereas now it's a little bit more complex than that, like you said, and even individual tolerance to pain, right? Because let's say two people experience the same injury, is their pain experience the same? I don't know. So that's a pretty kind of interesting, I guess, rabbit hole to go down. So feel free to kind of.
Well, with the disc injury one, especially spontaneous reabsorption or like recovery from a disc herniation, if I'm not mistaken, the prognosis, like you're more likely to get better if the disc herniation is worse. Like for whatever reason, like if it's a complete sequestration where like that's like it like blew up and you don't have to do surgical intervention for that, like there's no inflammatory issues or anything like that where the spinal cord's affected, for whatever reason they actually improve much better than someone with herniations that like aren't complete and they're smaller and they're just kind of like nagging. And so then I think what happened is people started to ask those questions, or like, okay, well then what's going on if something that would be technically more injurious with tissue damage, you would think that it would be a worse prognosis. But for whatever reason, when it's a smaller herniation and they don't get better within that like 3-month period where that's for some reason spontaneous reabsorption kind of happens, people are still getting nagging back injuries or like nagging back pain. So then you wonder, like, this is where the BPS model kind of makes sense, is they've been told this, like they have this thing, and it's instead of a lot of patients we meet, instead of teaching them tools to kind of either mitigate flare-ups or work around it in the meantime, they're told that they can't do this, they can't do that. And so then it builds more anxiety and it builds more disempowerment, and they don't feel like they have control of what their body is capable of. It withdraws them from their social networks, whether it's like from their powerlifting team or their sport or whatever the case may be. And because of those things, those are going to perpetuate pain too, because now you got anxiety, and that's going to make you more sensitized just because you're anxious about it. You're something that's out of your control. Now you're not with your normal social group and you lose that little bit of support or that feeling of connection. Or now you're no longer doing meaningful activities that like you really, really love. And those are things that are just going to perpetuate the sensitivity of the individual. And maybe that's why, like, maybe that's actually why, like, it's not the actual tissue is herniated, and that's why we're unadaptable, and you can't quite get into those positions again because you're afraid of them. And then that's really what's actually happening, is that your brain or your nervous system is so ramped up to protect those positions that that's maybe where the pain is coming from. It's like no longer actual tissue that's the pain generator. Maybe it is, like, obviously there's like a spectrum of it, but I would start to think more along those lines, is like, is it still the tissue that's being the main generator of pain, or is it the social construct of it? Like maybe they're just afraid of that movement. So that potential tissue damage is worrisome. So then their body's like, no, don't go there. I'm going to send a painful stimulus. And then they're just going to be like, yeah, that hurts anytime I bend over because I can't bend over. I have a disc herniation. Like, it's so strange because some people, like you said, can have them and they'll never have the symptomatology.
Yeah. And I mean, like, that's a pretty powerful aspect too, is the whole nocebo effect, right? Like, you expect something to happen and sort of ends up being a self-fulfilling prophecy. And like, there's a lot of really cool research on like orthopedic surgeries. I'm sure you're probably familiar with that, where they do like sham surgeries. And so essentially, if anyone who doesn't know what a sham surgery is, basically they just pretend to perform a surgery on someone. So they, go through the whole procedure. They, slice you open, but then they don't actually perform the surgery, and then they just suture you up or whatever it might be. And they tell you that you got the surgery, and that actually tends to perform basically just as well as the actual surgery for it within the context of, that research, whatever, for certain orthopedic surgeries, which is really interesting because it's like, that doesn't mean that the surgeries are ineffective, because there are certain people who wouldn't experience a beneficial effect from placebo alone. But then it also does show that placebo itself is a pretty powerful, I guess, remedy. I don't know if that's the right word, but it has a pretty powerful effect. And then the reverse is also true, where you tell someone that they're ill and all of a sudden they fall ill. And there's a whole kind of like literature on those things as well. But it's pretty interesting, like the power of expectation, like even you just go into a clinician, like it, when I go and see you. So for those who are just kind of listening, I'm based out of Calgary right now, and so is Ray. So his clinic is out of Calgary as well. So I go to see you. There is some sort of expectation, like, hey, I'm going to go there. He's going to figure it out, and we're going to feel better, and that alone just sort of like is a little bit of an anxiolytic effect,
For sure. Absolutely.
Because it's just like, it just kind of makes you feel, or makes me feel a little bit better, because I'm like, okay, I'm getting this treated. And then one thing that I'm kind of curious about, actually, and I don't know if there is anything on this, or if you have any sort of opinion on this, but I would be interested to know differences in pain experience between people of different temperaments. So, I guess if I'm just going to be really crude about it, there are certain people who are just pretty gritty and tough, and there are certain people who are just little bitches. And, and I wonder if the pain experience is actually any different, or if their tolerance is just higher, or you know what I mean? Like I would really
totally know what you mean. Yes.
Differences between those two things. And I would like to know how that actually impacts that sort of stuff. Like, because that is kind of part of the psychological and the social component as well. Like, I mean, when I was growing up, like my family and the neighborhoods that we lived in were pretty rough, and so like if you get into some shit, like that's just it. Like I remember I got jumped and I got slashed real bad with a knife one time, and like I just went home and got sutured up at my house. Like there was no going to the hospital. We didn't really have, like, couldn't afford it. You know what I mean? So it's very, I don't know. I just wonder how that changes from person to person. I would be super interested in learning about that, because I have no clue.
You should take this course, actually. Greg Lehman, he's a Canadian chirophysio.
Oh yeah, I know Greg Lehman.
Yeah. He
I don't know the course.
He talks about this. It's called there's an online one that's really awesome, and then he hosts them in different places. I don't know if he's coming to Calgary, but his online one was awesome, because that he draws that parallel of like people who are just tough and people who are little bitches. He says it a little bit different. He calls them endurance copers. He calls them endurance copers and then avoidant copers. There are people who are very fearful. They're usually the ones that probably need to be pushed into the direction of like loading towards processes of discomfort. And then there are like endurance copers who will just kind of like bite on a wooden spoon and just kind of keep going, even though you're just perpetuating that pain message. And the thing about the nervous system is it gets really efficient. And if it gets really efficient at sending a pain message, this is kind of like going into Butler's stuff. Like you're creating, I don't know if it's a memory is the right way to describe it, but they call it neurotags. It's like you're creating, you're reinforcing a painful message out of a position, because you're constantly doing it. You're just like not giving the nervous system time to desensitize from those either positions or loads or whatever the case may be. And those are usually people you got to be like, just chill out, man. Like, take it easy. We'll come back to it. Let's figure out a way to load elsewhere. And I find most sports, like certain sports have more endurance copers, and then most athletes in general are usually endurance copers. Like they're the ones that you have to tell them to just chill out for a bit. Let's figure out another way to do something so that you don't have to keep getting injured, or you don't have to keep loading this tissue where you might be decreasing your capacity because you're just reinforcing this pain message. And then I would say there's definitely personality types that are avoidant copers, but I wish there was like you said, there was like a survey. I wish I could send a survey to all my patients. They could fill it out and would score them based on if they were an endurance coper or an avoidant coper, because then it would make my job way easier, because I'd be like, nope, we're doing this. You're going to have to buck up, or no, let's pull back and kind of do that. It would just be easy to classify people that simply, but it's not quite that easy all the time.
Yeah. And I mean, that makes sense. The idea that, a decent percentage of athletes would kind of present more as an endurance coper, as you.
Yeah.
Okay. Yeah. Just because obviously you do have to, there's probably a little bit of a survivorship bias where, if you do want to actually excel at a sport, you do have to grind through things. You do have to become, develop a certain level of mental toughness, dedication, competency, and all these things. So it doesn't seem like those would necessarily be separated out. So I can definitely see that being the case. Yeah, that's pretty interesting. I guess I guess it sort of comes back to coaching then, right? Like the whole client-centered approach. Like, it's so funny because when I'm talking to certain people, like, because I'm big, because I'm a powerlifter, and because I have tattoos, everyone's like, oh yeah, I just don't necessarily want to be coached by someone who's just gonna yell at me and have the tough love. I'm like, what? Like, you don't know anything about me. Like, why would you say that? And I get it, right? Because that's kind of what's perpetuated by the fitness industry. So I get that. But then at the same time, it's like, I've literally had, and this has happened quite a few times, where I've literally had people, I'll do a check-in and they'll send me back a response, and they're just like, wow, thank you so much. I totally didn't think that. I thought you were going to yell at me or something like that. But that was actually really helpful. I really appreciate being so understanding and da-da-da. And I'm like, I'm here to get you better. So whatever is required to get you better. Sometimes, yes, that is going to be me saying just shut the fuck up and get under the bar. I've got a couple athletes that I have a pretty good relationship with most of my athletes. But there's a couple who are here, we're local, that are actually friends of mine. And especially for them, there are times where I will say shut the fuck up and get under that, and actually get in their face about it, because that's how I get them to perform well. Right.
Mm-hmm.
That's not just me wanting to be emotional. That's actually, I know how to get them to perform. Then I have other athletes where I have to take the polar opposite approach, and there's everything in between. But that's kind of actually, you know what? I'll be honest. I don't think I've ever sworn at anyone. But the I guess that mentality though, just really getting in their face about it and being like, hey, it's time to fucking step up. Are you ready to do this? Just
yeah,
in their face about this. But but yeah, and so I don't know. It's just kind of funny, how different temperaments kind of require different strategies to actually get that outcome. And I would suspect, I guess, that's probably similar in terms of the treatment protocol, like you were saying, where some people need to be pushed a little harder. Some people need to be kind of, handheld a little bit longer.
For sure. And even at the clinic, for example, there are clinicians in our facility who are just way more, they will for sure be the one to tell you when you got to buck up. I'm not really one of those people. I'm very soft-spirited human being. And I usually just try, everyone says it's bedside manner, but it's sometimes you want to say that, but I don't know how this person is going to react if I say, you're just being a baby. I would love to say that to some people, but because sometimes that's the thing that they need to hear. But that takes time. Like you're saying, you're not going to say that to your athlete that you've been training for 3 weeks, right? And ideally, I don't want a patient, to see me for years, like maybe pop up every once in a while, but I don't want that. Like the goal is not for them to not see me anymore. So like that relationship doesn't always we just don't have time to develop that relationship all the time, because hopefully you're getting better by like visit 3, visit 4. And then we kind of just push you out to monitor it, or I work with your coach, and your coach is the one to do that, because coaches really, they develop a much stronger connection with their clients than we ever do as clinicians. Even though it's part of the process, like it's just time. Like you need those reps, and I'm not going to be the one to tell you to come once a week, every week for a year. Like that doesn't make sense. Unless you want to, and you don't want to do your rehab, and you have a ton of money to blow, and like I will work on. We can always make things harder. That's the nice part, is I could always make things harder. But most people generally just don't need that, or like they don't have access to that.
Yeah, no, for sure. And so I guess I kind of want to go back to talking about back pain again a little bit, because like spinal flexion is still something that's pretty controversial, especially loaded spinal flexion, extension, rotation, things like that. And understandably so. And I do think that there is a mechanism there for sure, but I also think that it sort of depends on context, because like I know that for myself, for instance, and this is sort of like just full disclosure, this is like an N=1 kind of thing, where this was my experience, where I had a very serious back injury, and I was like wearing a back brace and crutches for like 10, 11 months. And the specialists that I was seeing, they were like, so I was seeing a sports med doc, I was seeing a physio, and I got like some imaging done or whatever. And my back, my SI, like it was really fucked up. There was a lot of damage done. And I remember going to my physio, and I was just like, this isn't enough. Like, you're getting me to stand on a Bosu ball. And they're like, well, we need to develop stability. And I'm like, yeah, but like, okay, that's fine. But like at the time, my squat was still pretty good. And so squatting on a Bosu ball is not going to do shit for me, in terms of like the magnitude of stimulus. And I remember I did that for months, because I was legitimately scared that I wasn't going to be able to lift again. So I was just like, okay, I'm going to put my faith in the experts and listen to them. And I did that for a long time. And then I remember after a while, like I was just like, man, I just can't handle this anymore. So I stopped, and I was just like, I'm just going to do this myself. And I started doing Ukrainian deadlifts with a barbell. So for those of you who don't know what the Ukrainian deadlift is, basically you stand on something, and then you do a deadlift, but you really, really flex your low back, your entire back, basically. So I was standing on like a inch.
Huh? Kind of like a Jefferson curl?
The Jefferson curl, is that the one where you're
like curling down?
Yeah.
Okay, yeah.
Yeah. So I think the Ukrainian deadlift, the difference is that you're standing on two side things, and then you have like holding like a kettlebell, like a heavy kettlebell. Yeah. I think the Jefferson, yeah. So I guess this is more of a Jefferson deadlift then. But I was standing on like a 6 or 8 inch block, and then doing that with like just an empty barbell was even like too much for me. So I had to have like two 5-pound dumbbells, and I was doing that, and I was like shaking. But then after a while, I got up to 70 kilos and then 100 kilos. And I was actually working up to like 350, 400 pounds, like major spinal flexion, which again, not recommending that to anyone. But I was fully like back to normal within, I want to say 6 to 8 weeks, like lifting all my normal weights. And now I actually program that for myself, because I just feel really, really good when I do that, and I don't do it with that much load, because I usually do it after my actual deadlift. So I'll usually do it with like maybe anywhere between like 100 kilos and like 180 kilos, something like that.
That's really impressive.
But that just feels really good to me, and like, I also think that there's something to be said about like being able to, I guess, sort of have that awareness of like, am I in a compromised position? And I feel like because I took a very, very long time to sort of build up to those things, now my tissues and all that stuff, I just feel very strong, very secure, very stable in those positions. Whereas I would never do that from the get-go. Like, there has to be a runway of kind of progression there. But then at the same time, I see people who incredibly strong, but they don't have a lot of positional tolerance in, like, I guess, a variety of different ways. and then all of a sudden they get injured. And a great example of that would be when I tore my oblique when I, went to throw a punch when I just started boxing again.
Yeah.
Right. And so, but then there's also like a lot of variability in that too, because like if you look at rowers, cyclers, football players, all these people, you're getting huge amounts of compressive force and repeated flexion extension moments. And then especially for football, like that's incredibly high impact, like 200-300 pound dudes smashing.
Yeah. Yeah.
And so but they don't really present with any higher risk of injury or anything like that. And so
other than brain injury, but like
yeah. Sorry. Yeah. I meant back injury.
I know, I'm just joking.
Yeah. No, that's a really important distinction. But that just kind of again throws another wrench in the wheel where it's like, okay, well, what actually is the mechanism? Because I do still fully believe that, yeah, like probably loaded spinal flexion is a mechanism. I do believe that. But I also think that there's a lot more that kind of determines whether or not that's going to be a potential risk factor for individual A versus B versus C, And so what are your thoughts on that?
So what we normally, like when I teach our clinicians, like I like to say, I'm like, just classify people in their intolerances. So like if someone has a flexion intolerance, they're just basically, they don't like it. So that's going to be the thing that sensitizes the structure that's causing pain. So you know what you do? You avoid it for a while and then you slowly load them. And that was probably what you were doing. That's exactly what you were doing. And you're progressive overload over a long period of time with a lot of consistency. The tissue is going to have to buttress the area and lay down new tissue. Like that's just Davis's law of soft tissue. Like it has to happen. And if it doesn't happen, you will probably either not get stronger or you're going to be in pain because the area will get sensitized because it's not able to heal. And then there's like extension tolerances. Like people just don't like being in extension for whether it's repetitions or loads. Like that's just usually how we classify them. We don't say like, oh, this is for sure a disc, because we don't know that. And even if it was a disc injury, like it's not going to change how we modify your rehab. It's progression of like, and graded progression of overload and graded exposure to the pain, like the ranges of motion and the position. So I feel like a lot of people they want to be classified so often because it gives meaning in just making sense of it. But that's where I think it's almost disempowering, because like you should just focus on what you can do. Like, let's just focus on what we can do. And like, if what you're doing can be loaded more or made difficult, it's worth it. Like that's because like a Bosu ball, what the fuck are you going to do? Like you're just going to put another Bosu ball underneath and then we're going to put another Bosu ball underneath, or now we're weighting it. Like why? Like it doesn't make sense to treat or create stability by putting you on something unstable. Like that's nonsense. It doesn't make any sense. But and then you've just figured it out on your own. You're like, I have a flexion intolerance. It doesn't hurt when it's unweighted, so let's do that. And you just progressively over. Like it makes sense, because as long as the person can adapt to it, you give it enough time. I don't see why it would be a bad thing either. Because even when we do hip flexion, like your spine still has to flex anyways. So why is it something that we should demonize or create fear around? Because you're going to flex whether you want to or not. It might not even look like it, but it's happening. Because it might not look like it because your back is straight, but naturally our backs are in lordosis, or like there's a curve. So it seems silly to just tell someone that they can't do that, because then they'll get cancer or something. Like it doesn't make sense. It's nonsense.
Yeah, that's definitely like, it's interesting what you're saying about like the whole diagnostic process, because on the one hand, like I definitely see where someone is coming from in terms of wanting some sort of plausible rationale for like, why am I in pain? Like, and having it make sense to them, I think is a really, really important part. But then at the same time, if that individual sort of internalizes it exactly like you were saying, oh, I have a disc herniation, so I can't do A, B, and C. And it's like, okay, well now it's becoming problematic. And so I guess it sounds like, and I want to make sure I understand this correctly, it sounds like for most people, you, rather than talking about what the injury is, you'll be like, this is kind of what I think it might be, but that's not really relevant because here's how we're going to approach it, and here's why we're approaching it like that, and here's why, regardless of if it's this, or this, it doesn't matter because we're going to take the same approach anyways.
Yep, that's exactly what I say. Like even shoulder injuries now, people are like, "Oh, I have a shoulder impingement." And I was like, "Okay, that means so many different things. Like that just basically means you have pain in the front
shoulder
of the shoulder."
pain, yeah.
And I was like, you know how many things are attached at that point? Like there's the subscap tendon, there's a supraspinatus tendon, there's like the lat tendon's not far off either, and then there's like a bursa sac there, and then there's like an AC joint, and really all it is just sensitive tissue that are just it's just that's it. It's just sensitive tissue. And usually what I'll say is like, well, okay, it could be a subscap tendon or it could be like just a strain in the muscle, but really it doesn't matter because the only thing that will change based off that information is either how long it's going to take to heal, because muscles just heal much faster than tendons do. But it doesn't change what we're going to do. It's going to be slowly progressing the movements, give them an opportunity to figure out other tissues that they can also load in those positions and modify it as best they can and show them that it is modifiable and that it doesn't have to hurt if you do maybe a little bit different way in the meantime, and then slowly go back to the old way you do it, or maybe this is still better for you. Who knows?
Yeah. And I think so I remember personally when I first started hearing about some of this stuff, I was a little bit skeptical.
Sorry, Daniel, I think you're muted.
Oh, can you hear me?
Give me a second here. Okay, let's try that again. Can you talk?
Can you hear me now?
Okay, sweet.
Good.
Here we go. Sorry. Go for it.
All right, cool. You can hear me now?
Yep.
Okay. Yeah, like I remember when I first heard, I can't remember who it was, but I was watching a lecture and essentially they said the same thing. They were like, yeah, it doesn't necessarily matter what specifically it is because we're going to treat it the same way. And to me, I was thinking like, because again, I tend to be one of those people who sort of obsesses over details. And I was like, okay, well, like if there's an issue with your engine, and this might be a terrible example because I know nothing about cars. It's like, is it the spark plug or do you have a gas leak or, you know what I mean? So I'm like, that matters, right? But then,
sure.
And so like I asked the question and then he was like, okay, well, let's look at it this way, flex your teres minor. And I was like, okay. And I was like, I can't. He's like, okay, can you flex your supraspinatus or subscap? And I was like, no. And he's like, okay, why not? And I was like, well, because everything else is going to fire on. And he's like, okay, so is it really that important that we, specifically isolate which muscle it is? Or, is it more important that we look at the coordinated like movement of what's actually going on and
exactly.
Which positions actually cause you issues? And then we just train those positions because whatever is in control of those positions and stabilizing and generating the movement and blah, 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 is going to be strengthened and reinforced and stuff like that. And I was like, oh, okay, that kind of makes sense because, yeah, at first when you hear that, when it's like, it doesn't really matter what it is, I was like, what the fuck are you talking about? Like, what are you, a quack? But then when you think about it more and more and more, you're like, oh, okay, like that does sort of make sense, Can you talk a little bit about positional tolerance though? Like an example sometimes that I use is, again, like me tearing my oblique. So my squat is my best lift by far. So I clearly don't have weak obliques.
Yeah.
Yet I threw a punch after not having boxed for like 10 years. And it was like, it wasn't even hard. I was just moving fast. And all of a sudden, boom, just tore my oblique, And so That kind of speaks a little bit to positional tolerance, but can you kind of, I guess, go over that with some of the people?
I think like, so positional tolerance, this is where it kind of gets into the nitty gritty too. Cause like, something might be very, very good at, loading in an eccentric force, or much better at with speed rather than with like like tension. For example, like back squat, we know you could your tissue is strong enough to deal with a lot of force in a deadlift or back squat or even like a bench press, but it becomes a different type of force when you're throwing it and then there's a resistance that's meeting that exact same force with speed now. Because most of the time you guys are lifting at a slow rate unless you're on like a speed block where you're kind of just repping it out, right? So you were peaking for nationals, or what was it for? Yeah. So you're probably not on a speed block where you're doing faster movements. So your tissue is not adapted to those positions with the speed that's involved. And it's just like a huge movement. You can't really like it. The way you train for it is by punching. Like that's just kind of how it goes. So, so now you've put yourself in a state that you just haven't been adapted to quite yet. And the tissue just kind of like, it was just like, nope, that's not what we do here. I'm going to stop this before it gets any worse, and then go from there. And also like, cause you're peaking for nationals, if we were to use the biopsychosocial model a little bit more, everyone should kind of like dive in when it matters. You're probably nervous because you're like, I injured myself now. I have nationals coming up. That's going to make things more sensitive. Like it's just part of the process. Your brain or your nervous system is going to prioritize this because you have a goal that's set in mind and now you can't achieve it, or like now there might be something impeding it. So it's going to make it more important in your brain to like pull you back. And so there's that part of it as well. Like that's like another layer that you just kind of have to address. And the thing that's nice is I could just be like, okay, we're going to load this just so that you know that it's safe to keep training. And then that in itself is anxiolytic, like you were saying, gives you some confidence to keep training, that you're not going to hurt yourself. And then pain dampens. It might be uncomfortable, but like pain will dampen. It's no longer a 5, it's a 3 or a 2. And you're an athlete, so you're likely to be able to tolerate a 3 or a 2 a little bit more, and you kind of like push through until nationals happens. Like that's fine. I'm okay with that. That's kind of where the goal is to get you to the game, right?
Mm-hmm.
So it's just what you've been adapted to. Because like, you know, like once a year I will try to do some breakdancing that I like used to do when I was younger. I'm like 80 pounds heavier than I was when I was breakdancing too.
Yeah.
And it hurts, but it's just because I don't do it. And I put myself in a position that I just don't train, that I've never used. And I don't spin on my head on an everyday basis. So it's going to be a little bit sore when I do that. So it's because the nervous system's like, hey, we've done something we don't normally do. Maybe back off so I have time to adapt to it. It's just, it's creating a prioritization process that's much more efficient than we give it credit for. Like we're very adaptable and resilient, but you just got to give it a chance to do it. We're not like cars in that regard. Like there's no handheld computer that I could plug in to tell me exactly what's wrong and then just change it. It's not that simple, which kind of makes the whole playing with thresholds, playing with capacities, playing with the introduction of different ranges or positions that you need in the meantime. But that's kind of where that capacity builds out, is it needs to be introduced slowly. Mm-hmm. Or maybe fast, but it has to. I kind of saw it on the Mike Israetel thing, like maximum recoverable volume. Like you got to toe the line to kind of for greatness. So if you push the threshold a little bit, things are going to be sore. You just know that that's where the threshold is right now in the meantime.
Yeah. And it's kind of funny because on the one hand, like it's sort of counterintuitive that you might think that like the stronger you are, the more risk of injury you have if you go outside of your sport, you know, because it's
Yeah.
like you're there was a time where I was running with a girl that I was seeing, and she was a runner, and um I remember she was like, "Oh, I'll beat you in a race or something like that," and I was like, "Oh, maybe, I don't know. I'm slow and I'm fat," you know. And so she started running, and then I started running, and I was probably running at like maybe 40%, and I blew by her, and then I just stopped, and she kept running, and she's like, "Oh, I win." She's like, "Why'd you stop?" And I was like, "Cause I could tell that if I ran any faster, I felt like I was going to blow my hamstring off, you know." Because it was like it felt like nothing. Like even though I'm big, like my squat's really good, and I do a lot of like split stance work, like Bulgarians and things like that. So I mean, I think my power to weight ratio is still in a very productive range, but I'm not used to that ballistic transfer of force where it's like I can't remember what sprinters do, but it's something like 6 times or whatever their body weight ground
Yeah.
reaction force or some crazy nonsense
I
where
think it goes up to 10 too for some of them too.
yeah, like just insane amounts of like force generated into the ground in like a fraction of a second. So it's like if your Achilles, if your knees, if your hamstrings and everything is not ready to offload and then reload quickly enough, and there's some sort of break in that cycle, man, you could be running into some issues. And so, I mean, gosh, I can't remember his name. PT Fitness. He's like a really crazy strong dude, super jacked. And he was like just messing around with some box jumps, or sorry, some jumps, and then he jumped over one thing and went to do a rebound jump and blew his quad tendon.
Oh,
Right,
God,
just
that's
like because he doesn't do it. You know, he's
yeah.
crazy strong, crazy fit, but he just doesn't do it. And so he just wasn't prepared, and his tenants were like, "Nope, not having it."
Yeah,
That's
it's
really
insane. And I think like the highest injury rate sport is actually like sorry, like population is men in their 30s that play basketball. Because it's like, like you're just playing
yeah,
a pickup game, big jumping, sprinting, fast cutting, all that nonsense. And then they're like, I haven't played since high school. Now I'm going to play. Like you're
yeah.
just not accommodated for those forces. You just haven't adapted to it. Like from high school to 30, most men are probably 30 to 40 pounds heavier than they were in high school. So then now you have like an increased force just simply because your body weight, and then they haven't trained for it, and they think it's simple enough because it was simple. Like it's just something that you normally played, and then not realizing the tissue is just not prepared for it.
Yeah, no one's gonna play for like 2 minutes and be like, all right, I'm gonna bench myself for for a little bit, and then
No
like
way.
I'm gonna do 5 sets of like 2 minute intervals and take it easy. It's like it was
Yeah.
just going ham. And it's so funny actually that you bring that up because like when I used to work in this really, really big fitness club, it was World Health at the time, but it was like a sports club. So they had like professional tennis players there, a whole tennis court, squash courts, chiro, physio, like outdoor pool, all this crazy stuff. And I remember you'd walk by and you'd see like these older guys playing squash, and they had like arm braces, like knee braces, ankle braces, wrist braces, and they're just doing all this stuff. And it's like, meanwhile, they're drinking beer while they're playing, and it's like you're just like a walking injury because they're not doing anything, but they're just going so hard, but they're not building up any. They're not like, huh, maybe I should like lift some weights or do something to make sure that I can actually play this aggressively.
Yeah. Like it's fascinating how much GPP is just discounted these days now. Like just to be able
Walking.
to, yeah, and tolerate something heavier outside of your body weight. You know what I mean? Like it's wild. So and
Yeah,
like you're at Strength Edge, right? So
yeah,
in terms of building capacity, those strongmen, braced flexion, braced extension, where they're like, you don't go from 0 to 200 pounds right away. They're like
yeah.
building
I
up to it, right?
don't.
Like, yeah.
Yeah.
You build up to it. You build your tolerance for it. So, and that's the thing, is it's a rep game, right? You got to figure out how to do it.
Mm-hmm. Yeah. And so when it comes to training and pain perception, like, it's funny because there's like a lot of different presentations of pain. So like some people will train and have no pain when they're training, but then they experience pain after. And it's like kind of a residual pain that just kind of lasts throughout the rest of the day. But then while they're training, that actually makes it feel better. But then also, if they continue training, it kind of gets worse, if that makes sense. Like not in the training, but after.
Yeah.
You know?
So that's actually indicative of like probably tendinopathy,
Mm-hmm.
which like it's like the presentations of symptoms are usually after the fact, and it feels better with movement. Like that's probably more so. And then so that just means that they just need better. They got to figure out how to like load a little bit more into the muscle belly rather than the tendon, like take away some of the explosive stuff or some of the like the capacity building, or like the tendon's role in those movements that they're doing. So that's like historical information where you're like, oh, okay, we need to go heavy and slow right now.
Mm-hmm.
But that's just kind of like you're taking information and then changing their training based off of it.
Yeah.
But that's more so what it would be then. It'd be less so like sensitivity to the positions. It's like the tissue's just pissed off because it's doing a little bit more than it should be.
Yeah. And so can you just go over maybe some of the, I guess, potential triggers of pain? And obviously these aren't like ubiquitous where it's like all of these are going to be present, but like, for instance, I know, velocity obviously is one.
Yep.
And like even weightlifters kind of have to do some eccentric loading every now and then because there's just like virtually none of that in their training, right?
No.
Um, and so velocity is one, obviously like range of motion is one. What are some of the other things that, you can kind of look at a program and say, hey, they're experiencing pain, but I'm noticing we never do any, maybe it's volume, maybe it's intensity, I don't know, right? What are the
Honestly,
things you look at?
it's for sure volume's like the number one thing I think is the first thing to look at. And I like to look at how many days they're training. So like total volume, daily volume is like the first thing that I look at, because we work with a lot of CrossFitters as well.
Mm-hmm.
And half the time it's just poor volume management. Like they're fucking doing like a bunch of gymnastics, and then they're doing weightlifting, and then they do fucking 200 burpees, and you're just like, yeah, you're gonna have shoulder pain just because like the tissue can only tolerate so much cyclic load. So you just got to like back off on volume. It's probably the first thing that we look at, and then we look at like range capacity. Probably, I think people just maybe don't address what they need for their sport, and they like kind of grunt through it. For example, like let's just speak on like for powerlifting. Generally, you guys don't need like a bottomed out dead ass into the bottom of the squat like weightlifters tend to do, because it's just not part of your sport. You don't need it. So then what happens is like, yeah, I was tying my shoe and that's when I like blew my back out kind of thing. We're like, okay, well, thinking about tying your shoe is like it's bottoming out hip flexion. So maybe we just need to make it so that you have that range available, so that not for your sport, but for your everyday, so that you don't have to use your back into those positions nearly as much. Because I mean, you're already loading it a lot in your sport or whatever. Maybe like it's just because your volume was bad and that was the straw that broke the camel's back. Like it was just too much. Too much of anything is exactly that, right? Too much. So I would look at that. I think very long plyometric blocks, like if they're doing a lot of speed development stuff, like I I don't think it could be done for like an 8 week block. Like I think that you would just get a lot of really sore tendons if you ran a cycle that long. Like tendons take a long time to heal and kind of build up new collagen fibrils and stuff like that. So if you're introducing some of those like plyometric movements, like box jumps and things like that, just to get fast, or like faster squats or whatever the case may be, you just have to give the tendons some time. So I don't think you should run them for very long either. So being weary there and timing that with your training periodization is going to be really important, but that's more a coach's role.
Mm-hmm.
But if I had a patient that was like my like knees are fucked up, I can't do this anymore, and we look at a block and they've been doing box jumps for like 8 weeks, I'm like, okay, well, you're going heavy and slow for a while. Like we just need to make it just chill it out, because it's so loaded, right? Like that's the whole point of the tendons, to store energy, and it's just it can't do it for that long, that often.
Right.
And like runners, like you just got to look at their total mileage. Sometimes they're just running a lot. You have to back them off on their volume. Like whatever they're doing is they just can't tolerate it anymore.
Yeah, one thing that I've noticed, like, kind of as I've become a little bit more experienced, is like I'm finding pain to be an actual, like, a really useful indicator um, of programming for myself, anyways, and even for
Yeah.
my athletes sometimes, because like and again, pain is obviously like kind of this broad spectrum. So I'm not like, oh, you tore your bicep, I guess we need to back up. You know what I mean?
Yeah.
It's not getting to that point, but when people are like, hey, I'm noticing I'm getting like a little bit worn down. It's not really like anything big, but my shoulder just doesn't feel that great. I'm like, okay, cool. Let's look at that. So you're almost able to kind of get there before they actually start presenting with pain. At the moment that I'm talking about, I guess it's just like, I don't know, something just feels off. And that's really it. It's just this like perception of something being wrong. And so we're like, okay, cool. And then, like, I guess the most recent example that was actually something that someone said to me, and I looked at their program, and all I did was I adjusted on one day. Instead of having them bench to their chest, we made it to a 2 board. That's the only change I did, just on one day. And then boom, by the end of the next week, they felt great again, no issues. Right. And so
Yeah.
it doesn't have to be this like drastic change, but I find that stuff can be really, really informative. And even like if you do have an injury, sometimes it is like, hey, what's actually going on? I mean, my hip pain that I was seeing you about, right? Where it's like, why can't I get into these? Or oh no, maybe I didn't see you about that. I saw you about the adductor.
Groin.
Anyways, yeah, it doesn't matter. But like you kind of have some pain, and it's like, well, when are you getting in pain? Well, I always get in pain once I reach a certain volume, like you were saying. But then I need to be able to get higher volumes, or at least there, before I can progress. And so it's kind of like sort of double-edged sword, where you need a higher threshold of volume, but then when you do that, something's going on, something's being pushed too hard. And so then it's like it kind of leaves clues a little bit to like, hey, what do I need to do differently? Where am I kind of lacking in capacity, or whatever it might be?
Yeah.
So yeah, I don't know. I think it can also be like a pretty cool indicator for like, where you might need to double down and bolster up a little bit more resiliency in your athlete as well.
The only thing that's it takes a long time for, I think, an athlete to have the awareness really to know when something's feeling a little wonky, right? Like we've been doing this for so long, so we know when something feels a little weird. But you have someone first year in, where the first 3 months are always sore anyways, because like they went from zero to weight training, and they don't know what kind of funky feels like. That's kind of sometimes our role as a clinician, is just telling them that soreness is normal and it's safe, and stiffness is safe. It's just, as long as you can warm up out of it, you're usually pretty good to go. If it's modifiable, pretty good. Like you can go, it's fine. Or like shorten the range of motion for a while, like see how it goes for a couple of weeks, kind of like what you did.
Yeah.
It's I don't think it has to be that takes a very good coach. So that it speaks volumes on how good of a coach you are. Because some people are like, just buck up and finish the thing. We'll change that the next block. But sometimes you need to make those changes in the program, like in that training block. You can't just tell them to tough through it until the end and then fix it later on. Like, it's just not how the body works. It's telling you, it's giving you information, and you can't ignore it. You have to do something now, or like at least put a pause on it. Don't progress anything. Just like give it time to accommodate change. It could be as simple as that too, but it's not always easy. Simple, not easy. Like it's
yeah. And I've definitely had clients who, because like on my check-in form or whatever, every week, one of the things that I have is like, any additional comments or concerns, and I make a video that I send to them, like like walking them through everything and like what I'm looking for in each section that they're filling out. And so I talk about like, like, is anything hurting or bugging you or whatever. And like the first week with one of my new clients, this was quite a long time ago. They were like, yeah, my back hurts. Like I injured my back. And I was like, what? You injured your back? Oh my God. And anyways, and so like I'm reading this and I'm like, what the fuck happened? Like, and I'm looking at the program and I'm like, nothing seems to be out of place. Like it's like I'm talking like one set of like exercises. You know what I mean?
Yeah.
Because they weren't sedentary, but they weren't necessarily used to training at a high intensity. So I was like, okay, we're going to give them a bit of an intro block to kind of ramp them up over time. And so they had a very, very low volume and everything. And I was like, what the hell's going on? So anyways, I scheduled a call and they're like, yeah, like I hurt my back. And I was like, okay, what do you mean by hurt? Well, it's just really sore. And I'm like, what do you mean sore? And they're like my upper back. And I'm like, okay, what makes it hurt? And she's like, well, like if I reach forward, it just feels really stiff and tight. And I'm like, oh, you mean like this is just muscle soreness? Like,
Yeah.
and they had no idea. They had no idea. And I was like, okay. And they're like, well, man, like, I don't know. This just seems really intense. And I'm like, have you never been sore before? And they're like, no. And this was someone who'd been training for like 3 years, And I was like, okay, I guess you've never actually like really pushed or anything, So it's, I don't know, like differentiating like pain, because that can be painful. Like if you've never been sore and all of a sudden you're really sore, you're like, oh shit, sitting down is like a 7-second process now, but yeah, at the end of the day, it's like there's definitely like gradations of discomfort.
Oh yeah, and like we usually just say like I have a lot of patients. They're like, it hurts in the morning, and a lot of times in the back of my head is like, yeah, same. Like what do you expect? You're just kind of like going out of a position that you just were in a different one for 8 hours, hopefully 8 hours at least, and like it's just gonna take some time to kind of like move out of it, but you have to like guide them to that realization that like, oh yeah, like it's normal for things to just kind of feel a little protective. In the meantime, you kind of like move out of it, let your brain wake up. It's just telling you to just like take it easy in the morning, really that's all it kind of is. And then that you can modify it with just a cup of coffee sometimes.
Yeah. Have a shower, have a coffee, and you're good to go. Yeah. Awesome, man. So we're coming up on that hour mark, and I want to be respectful of your time.
Yeah.
Is there anything that maybe, we didn't cover, or maybe just kind of some final thoughts that you wanted to share with the audience?
I think I always have this quote. It's closed mouths don't get fed. And I think if you talk to your coach, let them know kind of what's going on, they can either modify or whatever they need to do earlier on before pain gets worse, or at least they could tell you to go see someone to kind of get a better look at it, if they think that that's what it is. But you have to say something. I can't fathom how often people will go through it not realizing that if they just asked about it, they could really, really just tackle it much earlier on. You don't always, things will be sore, like we talked about. You don't have to be in pain. Like it's just not really, it's not necessary unless you like it, but I don't know why anyone would.
Yeah. No, that's actually a really good point, because I mean, even I've got that from time to time where I'll be like, oh, like they'll tell me about something and I'm like, oh, what? Like, how long has this been going on? And they're like 3 months. And I'm like, how am I just hearing about this now? And they're like, I just didn't want to bug you, like you're doing a really
Yeah.
great job. And I'm like, okay, but like that is my job. You know what I mean? Like
Yeah.
either we can address it, or if I can't, yeah, exactly. Like you said, we refer you out, we find someone who can actually handle it because you being in pain sucks, right? And so it is literally sometimes just like they just don't want to put you out, which is like the funniest thing, sometimes.
It's weird. Yeah. Closed mouths don't get fed.
Yeah.
Just say something. Maybe not all the time. You're like, if you're like day to day changes, but like for 3 months, pain for 3 months, like say
Yeah.
something.
Yeah, no, 100%. Awesome, man. So where can people find you?
You can follow me on Instagram, Coach RSA, or you can book online at our website. Our website's dynamicyyc.com. It'll lead you to the booking site, and you could find us right across from MEC downtown. Well, find me right across from MEC downtown, 833 10th Avenue Southwest.
Awesome. And that's in Calgary, Alberta, guys. And quick question, actually, do you do any online treatments, assessments, anything like that?
We tried to during the pandemic. It's so slow and arduous that it's just not something that I guess, like we just don't have the processes built out for it. I would rather refer someone. I think there's also like a pain relieving effect of just having your hands on someone too.
Yeah.
So like they could just reassure you or feel stuff. So I'd rather find a practitioner that I would trust in if you're not in Calgary, because there's a lot of great practitioners. You just need to know where to look.
Right. Okay. Awesome. All right, man. Thanks so much for jumping on again. Really, really interesting discussion. And all that stuff's going to be linked up in the show notes, guys. Make sure you give him a follow. If you are in Calgary and you want a really good clinician, he's got a ton of great people. If for some reason you didn't like him or his haircut or something like that. And yeah, if you like the episode, you like the podcast, make sure you go give me a 5-star review wherever people do that. I don't exactly know where. I'm like the worst at promoting my podcast, if I'll be honest. But make sure you share it, subscribe, do all that fun stuff. Thanks so much, guys. I will see you later.